My eyes were opened when I met a doctor in Malawi who was responsible for 250,000 people. Patients were walking up to 100 miles to get to that hospital. During rainy season, there were 3 or 4 families sharing every bed in that pediatric ward. People were being systematically excluded from care. What I mean by that is that the system simply was not reaching those who were furthest away and poorest. My eyes were open and the burden was overwhelming. Then I met community health workers. I listened to them, I shadowed them, and like many before me, they changed my perspective. These are people who are doing everything in their power to provide care for their neighbors. They're from the communities that they serve. They're welcomed into homes and into lives, and they're there for patients in the most trying moments. Clearly, I had to rethink who a health worker was and how we supported them. And if they're health workers, what should the tools look like by their side? And what should the system look like that's designed with them and around them? We created Medic Mobile as a nonprofit technology company, and we committed to building world-class software for health workers in the hardest to reach communities. Today, we work with inspiring partners all over the world. We support 20,000 health workers as they provide care for 11 million people. Every day, this network is finding and caring for 3,500 sick children in their homes. Every day, they're helping 200 women and their families deliver safely at a health facility with skilled care. And this network is global, and it's growing. Now we're following a community health worker in rural Nepal as she does a home visit for a family with a woman who's pregnant in her community. These health workers have shown us that it is possible for systems to reach everyone. They've shown us time and time again that they can deliver high-quality care and services door to door, if only we do our jobs. And that means making sure that they earn a living wage, that they have the essential medicines that they need, they have continuous training and supervision, and they have technology that's designed with them and for them. Medic Mobile expects to play our part. In the next year, we'll expand to serve 15,000 additional health workers. Within 5 years, our goal is that the software is supporting 200,000 health workers as they provide care for at least 100 million people. That scale-up is happening in the context where general trends for maternal mortality and child mortality are promising. We have multiple country models we can point to. But the truth is that political will, funding for delivery, and new ideas are still critical. In too many communities, 1 out of 10 children will not survive until the age of 5. They will die before they turn 5. That is normal. That status quo is unacceptable and unjust. And in order for the pace of progress to pick up, humans and machines have to work together. This is already happening. Smartphones and smart software is guiding health workers to the right families at the right time, and then helping them provide the right care. Managers can see a stream of information and visualizations to see what's happening in these homes and provide support for the right health workers. New diagnostics and home-based testing is decentralizing care and meeting people where they are. And it's up to us to ask and answer the question, what should this look like in the future? What if the software in the hands of these women could predict which child in their community is most likely to be sick? Or which family is most likely to miss their immunization visit? What if the software could build across millions of cases experience to guide them on the course of action? And what if, as we need to roll out a new vaccine or we have new treatments to provide, the software could onboard them to that new responsibility? When we think about humans and machines as a team, we're freed up to focus on strengths rather than shortcomings. For humans, we might design around our abilities to empathize and comfort, to recruit and to motivate, to act with courage and moral imagination. And we might ask machines for help with all of the math, complex logic, and learning across billions of data points. And if we take that approach, I think we'll stop the conversation about machines replacing humans in a workforce. And instead, we'll be designing systems that can reach everyone. We'll be designing systems that create millions of jobs because these systems are being redesigned and we're rethinking who a health worker is. I expect these systems to operate within the resource budget for our one Earth. And I expect that this human-machine team is the only way we'll meet ambitious goals for health equity locally, nationally, and globally. We believe it's important what we build, why we build it, how we build it, and who contributes. We must stand by those who are marginalized and often ignored and put technology to work for them. We must design with deep respect for our own humanity and actively bring humanity into the technology. And we must put these people first. We must live up to the daily ambition, the hope, and the grit of the people and the heroes on the front lines. Thank you.
Thanks, Josh. So this is actually a question I've been wanting to ask you for a while. Months ago, I wrote Josh an email and asked him a rather broad question, I'm sorry for such a big question, about the shifts underway in global health that he thought we should be focusing on. And he wrote a very helpful email, 7 different bullet points, and at the bottom you said, technology needs to accelerate and enable these shifts, not hold them back. And I've been wanting to ask, and our audience might like to know, what do you mean by that?
So that answer was really about technology creating space for the shifts that we've known had to happen for decades, to people-centered care, to proactive care, these shifts that systems have been wanting to make, and from my view, technology was holding us back. I'm going to jump ahead and say, also, we're at a point now that technologists need to think about the future we're co-creating with the people that we serve. And we have to come to terms with the fact that when we're building something that helps someone, as soon as we make that statement, we're into distribution ethics and questions of distributive justice. We're talking about moral philosophy, we're talking about libertarianism and egalitarianism and utilitarianism. And I want to jump right into those conversations because those are questions about the world we're going to create. And just to add on to that, how we build these things really matters.
That was my next question. So.
Great. I'm really concerned about black boxes for algorithms and prison systems we don't understand, parole systems we don't understand. Global health cannot be the next thing we don't understand. And the systems shaping millions of people have to be clear and open and the best they can be. So how we build these things matters.
I wanted to ask you one more question, which I think a lot of people in this room, if they work in some of the same markets that Medic Mobile is working in, they feel that the emergence of AI is not really relevant to the context in which they work. You're based in San Francisco, but you work all over the world, and you see that connection and you're acting on it now. So any advice for how people can navigate these shifts?
It's a great question. I'd have 2 pieces of advice. The first is for people who live and work alongside those who should benefit from the technology, just own the challenges and own your understanding of the daily lived experiences. Focus on that, tell the whole world. Over time, technologists will find you and we'll find teams. The second thing that needs to happen is we need more philanthropy and weird capital that's allocated to let the smartest technologies and smartest technologists focus on these types of problems. Until we can't hope and wish that the types of products that are built will apply because it's too important to hope and just wish.
Thank you, Josh.
Thanks.